All right, so euthyroid 6 syndrome, which is now more commonly known as non-thyroidal illness syndrome. So this is thought to be a self-preservation technique that the body uses that we've evolved, where the sick body can't convert T4 to T3. Instead, it converts T4 to reverse T3, which is the inactive form of thyroid hormone. And this is the situation where if you were going to check a reverse T3, this is really the only situation where it would be useful. The problem is in clinical practice, by the time the reverse T3 comes back from the lab, which is usually 5 days later, the patient's already recovered and you already have your answer. So in general, you're just never going to check reverse T3. Usually we'll see a low or normal TSH, a low or normal free T4, and a low free T3. So everything is low, and then high reverse T3 if you measure it. The thyroid is not the problem. There's no studies that show benefit to replacing thyroid hormone if the T4 is low in the setting of euthyroid 6 syndrome or non-thyroidal illness syndrome. The important point is never check screening thyroid test if you don't think that's the cause of the problem. So for a sick patient, so somebody in the hospital with some type of illness, if they're coming in for an MI, that's not the right time to check a TSH, unless you think they have storm or they have myxedema or severe hypo or hyperthyroidism, where the thyroid is the primary illness.